So let me just recap to make sure I got all of this right. Roughly 3 or 4 days of fairly severe low back pain, nothing that you can recall doing that really brought it on. Maybe a little bit to the right, but it certainly doesn't go down into your leg or calf or into your foot. Not having any weakness or tingling or any numbness in your legs. And just hurts a lot.
Yes, it does.
On physical exam, I found certainly some spasm or tightness in those muscles down in the low back, but nothing else that I thought was particularly concerning.
So will you order x-rays or CAT scan to find out for sure?
Is there anything that you're particularly concerned about?
Well, yeah, my brother had something, a slip disc or something, and just recently had surgery, and he had back pain for a long time.
I certainly understand. You don't want to go that pathway.
No. He really suffered for years before he had this surgery.
Sure. We probably wouldn't want to order imaging right now, but let's kind of run over that so that you understand where we're coming from. I actually have a little handout here, but there's really 2 or 3 different things that one might consider from an X-ray standpoint in this circumstance. One would be just plain X-rays. They don't really show us very much. For example, they don't show discs. They don't show slipped discs. And they only show bony problems, and very rarely are the symptoms that you have today the result of some sort of bony problem that would show up on X-ray. A CAT scan, sometimes people ask about a CAT scan. I don't actually find them to be particularly helpful. They are fairly high in radiation and irradiate things that I care about that could lead to problems like your ovaries, for example. So some people would go straight to an MRI, which your brother may have had.
I think he did, yeah.
An MRI is sort of the gold standard in terms of imaging the soft tissues. The problem is that even in healthy, normal people without any symptoms at all, we see quite a number of disc problems on MRI. They've done those studies where they actually got normal volunteers to go into the tube. So we never know for sure whether the symptoms that you're experiencing are related to a particular finding on the MRI. Your symptoms are not typical of what we would expect to see with a disc that ends up needing surgery.
Oh, okay. So the symptoms I'm having is not the disc problem.
So symptoms you're having are not what we expect with disc problems. We expect pain to go down further into the leg, even into the lower leg, and certainly some things that go along with that, numbness or tingling, sometimes even weakness. But there are things that we can do, however. I have the sense that you're worried that this could go on forever and end up in the operating room.
Yeah, it hasn't gone away.
Yeah. Honestly, it's sort of following the usual course for the people that I see with problems just like you, and there are some things that we can try to do to try to feel better, given that the usual time frame here is about 7 to 10 days, that most people are feeling a lot better after about 7 to 10 days. Don't go to bed. Stay as active as your pain will allow. Heat or ice to your low back may help. You mentioned perhaps taking some medicine, ibuprofen or naproxen are good over the counter. I'm happy to provide a stronger medication if you would like that. Most of them have a tendency to make you drowsy, so we have to be cautious about that. But that's up to you. There may be even some alternatives that you can do. Some people benefit from massage, acupuncture, so there are some things out there that might be a benefit to you.
Well, I have been, using the heat and the ibuprofen for, it's almost a little over a week now. You said week to 10 days, and it's not helped at all.
Yeah. Well, then I suggest for now we try to get something stronger, at least at bedtime, to get you through the night. Maybe a good night's sleep will help get you through the day. If your activities don't allow you to take something that make you drowsy during the day.
No, I
and then about another week or so down the road, I feel pretty confident that you'll be at a point where we can actually get into some exercise or physical therapy that'll help give you some relief from that pain. Let's just see if we can get you over the hump here first, okay?
Okay.
I don't think you're likely to end up like your brother.
You don't think so?
These are not symptoms that we usually associate with disc, so.
Okay, all right.
Shall we give this a try?
Yeah,
right.
I definitely will. Mhm.
That sounds good.
Thank you, doctor.
Absolutely.